Hello friends, today we are going to discuss about the coding of duplex procedure. Before learning the coding of duplex procedure, let us first discuss what is duplex procedure. Duplex procedures are those procedures which are used to detect vascular abnormalities, that is, the abnormalities which are related to the flow of blood within the arteries and the veins. These procedures uses high frequency sound waves to create real-time images of the organs and soft tissues and their blood vessels while measuring the speed and direction of the blood flow within them. These are most commonly used to diagnose conditions like blockage, stenosis, DVTs, and in the arteries of brain, extracranial or intracranial arteries, etc. There are various essential elements which are required for coding duplex procedures. These elements are mentioned below in the table. From element 1, element 2 and element 3 list must be required in the report in order to code duplex procedure. Otherwise, the duplex procedure should be downcoded to the respective ultrasound procedure. There are some important duplex procedure which are mentioned below. CPT 93880, which is the duplex scan of carotid arteries. These are also known as extracranial arteries. These extracranial arteries are present in the carotid region or the neck region. And in order to code CPT 93880, we require few elements which are internal, external and common carotid arteries that must, along with the vertebral arteries, must be documented in the report in order to code CPT 93880. This is a bilateral code, hence it requires both right and left internal, external and common carotid arteries and the vertebral arteries in the report. In case if any one of the artery is missing from the below or from the above mentioned arteries, then we need to go with the limited code, that is 93882. Or in case only right side carotid arteries are examined, then we need to bill CPT 93882. CPT 93886 is used to document transcranial Doppler study. There are two different CPT codes which are used in order to code Doppler or duplex procedure of intracranial arteries, that are CPT 93886 and CPT 93888. In order to code CPT 93886, we require following elements, that is, the physician must document right and left anterior circulation territories and the posterior circulation territories in the report. Otherwise, he can also document vertebral arteries and basilar arteries in the report. In case if any of the elements is missing in the report, then we need to code CPT 93888, which is limited code. In order to code the duplex scan of arteries of lower extremities, we are having two different CPT code. One is 19925 and other one is 19926. 19925 must be reported only if bilateral lower extremity artery duplex is performed and common femoral, superficial femoral and popliteal arteries are compulsorily mentioned in the report. Along with it, deep femoral and tibio-peroneal arteries can be reported, means these are not compulsorily to be reported in the document. In case if any of the artery from the above mentioned arteries missing in the report, then we need to go with 93926, which is for limited study. And in case if either right side or left side is performed, then also we need to report CPT 93926. In order to code the duplex scan of upper extremity arteries, we are having two different CPT codes. One is CPT 93930 and other one is CPT 93931. CPT 93930 is for complete bilateral study, and in case if subclavian, axillary and brachial arteries along with the radial and ulnar arteries that may be present or may not be present, must not be considered as compulsory, can be reported as 19930. In case of a unilateral exam, or in case if any of the above arteries which are mentioned above is missing in the report, then we need to bill it with CPT 93931. We are having two different CPT codes in order to code the duplex scan of extremities of veins. Duplex scan of veins of extremities, that are CPT 19970 and CPT 93971. In case of upper extremity and lower extremity, we are having same CPT codes, that are 19970 and 19971. For complete bilateral study of the upper extremity, we need to check subclavian, jugular, axillary, brachial, basilic and cephalic veins must be present in the report. In case of complete bilateral study of lower extremity, we need common femoral, proximal deep femoral, great saphenous and popliteal vein must be documented inside the report. Then only we will bill it with CPT 93970. But in case if any one of the vein is missing from the above mentioned veins in both the lower and the upper extremity, or a unilateral duplex scan of vein of extremity is performed, then we need to bill it with CPT 93971. Since we are having a single CPT to code both for the duplex scan of veins of upper and lower extremity, hence if both the upper extremity veins duplex and lower extremity veins duplex is performed on same day, then we need to bill CPT 19970 twice, and to one charge line we need to append modifier 59 or modifier excess depending on the insurance. We are having two different CPT codes in order to bill the duplex scan of arterial inflow and venous outflow of abdomen, pelvis and scrotal contents along with retroperitoneal organs. For complete study, we need both the arterial inflow and the venous outflow. In case if uh, arterial inflow or the venous inflow, out of these two only a single thing is documented inside the report, then we need to bill it with a limited code, that is CPT 19976. In case if both arterial and venous flow is mentioned in the report, we need to bill it with 19975. These CPTs are most common when these CPTs are most commonly billed with the ultrasonographic procedure of the abdomen, ultrasonographic procedure of the pelvis and the scrotum,